Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the mediastinum. Today my approach should be questions and answers. So we'll solve some questions about the anatomy of the mediastinum. First of all, what is mediastinum? Mediastinum is a space containing many structures, and the mediastinum is located between two pleural sacs. The lungs are not part of the mediastinum, so this is the space between two pleural sacs containing multiple structures. That is mediastinum. So these are the content of mediastinum. Lungs, diaphragm are not the contents of the mediastinum. So what are the divisions of the mediastinum? We divide the mediastinum into superior mediastinum and inferior mediastinum. How does the superior mediastinum separate from the inferior mediastinum? By means of the transverse thoracic plane. What is transverse thoracic plane? This is an imaginary plane between the sternal angle anteriorly and the intervertebral disc between T4, T5 posteriorly. Okay. What are the boundaries of the superior mediastinum? Superior mediastinum is bounded anteriorly by the manubrium sterni, posteriorly by the upper four thoracic vertebra, there is T1, T2, T3, T4 bodies. On each side, it is bounded by the mediastinal pleura. Okay, so we got the boundaries of superior mediastinum. What are the subdivisions of inferior mediastinum? The inferior mediastinum is subdivided into anterior mediastinum, that is present in front of the pericardium, the middle mediastinum that includes the heart and the pericardium, and the posterior mediastinum are the structures which are present behind the heart and pericardium. Okay, let's start. Go to the next slide. Okay, so here this is a schematic representation. Okay, so this is what is transverse thoracic plane. Transverse thoracic plane is an imaginary plane from the sternal angle, also called manubriosternal junction, also called angle of Lewis. It goes posteriorly between the intervertebral disc between T4, T5. So all the structure above the transverse thoracic plane are the contents of superior mediastinum. Structure below this imaginary transverse plane are the structures of the inferior mediastinum. Inferior mediastinum is divided into three parts by the pericardium containing the heart. The structure in front of it are the contents of anterior mediastinum. The structure inside the pericardium are content of middle mediastinum. Structure behind the pericardium are the contents of posterior mediastinum. Okay, we got that. So what is the boundary of the inferior mediastinum? Bounded by the anteriorly by the body of the sternum, posteriorly by the T5, T6, T7, T8, T9, T10, T11 up to T12. On each side by the mediastinal pleura. Okay. So now we'll go to the contents of the mediastinum. What organs are present in the superior mediastinum? Okay, organ, we have the esophagus, trachea, and the thymus. Esophagus, trachea, and the thymus. These are the content present in the superior mediastinum. Then, what arteries are present in the superior mediastinum? Superior mediastinum contains the arch of the aorta and its branches. What are the branches of the arch of the aorta? The brachiocephalic trunk, left common carotid artery, left subclavian artery. Okay, we got that. Now, we got the branches of the arch of the aorta. Then what are the veins and lymph vessels present in the superior mediastinum? Vein, will go to find out the vein. There is a superior vena cava. We have the brachiocephalic vein, left brachiocephalic vein, right brachiocephalic vein. Okay, and our lymph vessel in the superior mediastinum is the thoracic duct. Thoracic duct ultimately opens the junction between the left internal jugular vein, left subclavian vein. Okay, we got that. Okay, so we got the content of the superior mediastinum. Okay, then what nerves are present in the superior mediastinum is a content. Nerves, we have two major nerves. One is the phrenic nerve, another one is the vagus nerve. Okay, and also we have the left recurrent laryngeal nerve. We have the cardiac nerve. Phrenic nerve, what is the root value of the phrenic nerve? C3, C4, C5. Okay, and we have the left recurrent laryngeal nerve with the vagus nerve. Okay, and cardiac nerve. Okay, we got the content of the superior mediastinum. Now we'll go to the next slide. What are the boundaries of the anterior mediastinum? Anterior mediastinum bounded anteriorly by the body of the sternum, posteriorly bounded by the pericardium, below it is bounded by the diaphragm. Okay, we got that. What are the contents of anterior mediastinum? This is a narrow space. Its content, it may contain thymus in children. Okay, so it may contain thymus in children. Blood vessels, artery, veins are very small blood vessels are present there. Space is very minimum, but it contains sternopericardial ligament. Okay, so these are the content. Most important content is the loose areolar tissue, sternopericardial ligament, and thymus in children. Okay, these are the contents of the anterior mediastinum. Now, what are the boundaries of the middle mediastinum? These are the structures of the middle mediastinum. This is anterior mediastinum, this is posterior mediastinum. Boundary anteriorly anterior mediastinum, posteriorly posterior mediastinum. On each side, mediastinal pleura. Okay, below we'll get the diaphragm. Okay, we got the boundary here. Okay, so middle mediastinum, what are the content of middle mediastinum? Middle mediastinum contains the heart and pericardium. Okay, and heart and pericardium, and middle mediastinum contains the ascending aorta, pulmonary trunk, and the branches of the pulmonary trunk, left part of the pulmonary artery, left pulmonary artery, right pulmonary artery. Okay, these are the contents of the middle mediastinum. Okay, we got that. Then we'll go to find out the vein. What veins are present in the middle mediastinum? Superior vena cava is a content of the middle mediastinum. Superior vena cava is also present in the superior mediastinum. Okay, and we got the content: heart, ascending aorta, pulmonary trunk and its branches, and the pericardial and the pericardiacophenic arteries. What are the pericardiacophenic arteries? The pericardiacophenic arteries are branches of the internal thoracic artery. The pericardiacophenic arteries are accompanied by pericardiacophenic vein, okay, and the phrenic nerve. Okay, we got the contents of the middle mediastinum. Okay, again, heart, pericardium, ascending aorta, pulmonary trunk and its branches, pericardiacophenic vessels. What are the veins? Superior vena cava. Okay, then we must add azygous vein, and certainly the pulmonary veins. How many pulmonary veins? We have the 4 pulmonary veins, 2 on each side. Okay, we have pulmonary vein, and pericardiacophenic vein. What nerve is present in the middle mediastinum? That is the phrenic nerve. Okay, we got the contents of the middle mediastinum. Okay, then what are the boundaries of posterior mediastinum? So, posterior mediastinum is bounded anteriorly by the middle mediastinum, posteriorly by the thoracic vertebra from T5, T6, T7, T8, T9, T10, T11, T12. Okay, on each side we have the mediastinal pleura. What are the content? We are seeing some content. This is the esophagus. Okay, we have also the other content like the descending thoracic aorta, the azygous vein, hemiazygous vein, accessory hemiazygous vein. Okay, let me try here. We'll go there. So, what are the boundaries of posterior mediastinum? Content of posterior mediastinum. Okay, certainly the esophagus is the content of posterior mediastinum. What other blood vessels are present there? The descending thoracic aorta and its branches, vein, the azygous vein, hemiazygous vein, accessory hemiazygous vein, and certainly the lymphatic vessel, the thoracic duct. And the nerve, the vagus nerve, is the content of the posterior mediastinum. Okay, so we got some question here. Where does the thoracic duct open? It opens the junction between the left brachiocephalic vein and left internal jugular vein. What structures accompany the phrenic nerve? The pericardiacophenic artery, pericardiacophenic vein. Now we'll go to the next slide. Okay, what structure passes through the multiple mediastinum? Let's start. Trachea passes through the superior mediastinum. Okay, trachea is also a part of the neck. Okay, how about esophagus? Esophagus is the content of neck. It is a content of the superior mediastinum, content of posterior mediastinum. How about phrenic nerve? Phrenic nerve is a content of the neck. It is a content of superior mediastinum, content of middle mediastinum. How about the descending thoracic aorta? There is a content of posterior mediastinum. Okay, so we got that the esophagus is a content of superior mediastinum, posterior mediastinum. It is also a content of neck. It is also a content of the abdomen, small part. Okay. What nerve does pass behind the root of the lung and extend from the posterior cranial fossa to the abdomen? Answer should be vagus nerve. That is coming out of the brainstem from medulla oblongata, coming out of the cranial cavity through the jugular foramen. Content of carotid sheath, content of superior mediastinum, content of posterior mediastinum. Then it forms the esophageal plexus along with some sympathetic nerve. It is mostly parasympathetic, but esophageal plexus also get contribution from some of the sympathetic fiber, the thoracic region. From the esophageal plexus, we get the anterior vagal trunk, posterior vagal trunk. How that enter the abdomen? Those anterior vagal trunks and posterior vagal trunks enter the abdomen through the esophageal opening of the diaphragm. Okay, we got the esophageal plexus. Okay, so here some of the content of the superior mediastinum, like that of the brachiocephalic vein, superior vena cava, part of it, and also the part of the branches of the arch of the aorta. Okay, these are the content of superior mediastinum. These are the content of middle mediastinum. This is the phrenic nerve accompanied by the pericardiacophenic vessels. This is the phrenic nerve accompanied by pericardiacophenic vessels. Pericardiacophenic vessels. This is the content of posterior mediastinum. We have the esophagus here, descending thoracic aorta and its branches, and they have not shown it here. It should also contain the thoracic duct, the azygous vein, hemiazygous vein. Okay, we have some clinical anatomy. Mediastinal syndrome, we must know that mediastinum is not a rigid structure. Mediastinum can be moved in either direction, and As because multiple structures are close together, we have a lot of loose connective tissue around that. And also when one structure has some pathology, it may compress other structure. Or a person has lung cancer, that may disturb the recurrent laryngeal nerve. Or if a person has esophageal cancer, that may also compromise the function of other structure. So these are the mediastinal syndrome. One structure is affected, it may affect other structure. Dilated mediastinum is common, especially in case of cardiomegaly, aortic aneurysm, and pericardial effusion or cardiac tamponade. Aneurysm of the aorta is very common condition. What is aneurysm? Abnormal dilatation of the blood vessel, especially here is the ascending aorta, maybe descending thoracic aorta. Cardiomegaly, enlargement of the heart, may be a complication of hypertension. Pericardial effusion may be due to tuberculosis or virus, or maybe due to some type of cancer. Okay, there may be collection of fluid in the pericardial space that may be widened, the mediastinum may be widened, and we'll get water bottle sign in that condition. Okay, that's all about the mediastinum question to answer Q&A. If you like my video, please support my channel. Please share the information with your friends. If you have any question, please feel free to ask me. And have a nice day. Bye now.